Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and I can't tell you how great this YouTube experience has been for me. We have almost 20 million views, and I talk to so many people daily all over the world. I mean, it's really amazing, and thank you for following our channel. So, you know that my passion is cosmetic facial surgery, especially face and neck lift, and I'm in Richmond, Virginia, and I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, and butts, okay? So we're going to talk a little bit today about questions that I've been getting recently. So you have trends in cosmetic surgery where some procedure becomes popular, then it falls out of popularity and gains popularity. So one of the things people keep asking me, about the deep plane facelift, and is like that the only facelift? Is that the best facelift? Is that a magic facelift? Do I do that facelift? So let's talk a little bit about this. And first of all, I want to say that I'm a surgeon. I'm a teacher, I'm an author, I'm writing the 3rd edition of my textbook right now, and I'm just working on the facelift chapter. But I'm not cocky and I'm not arrogant. And there are so many great doctors out there that do fantastic surgery. And if you look at people that have done over 1,000 facelifts, and I'm working my way, I think we're right around 1,300 or something right now. We do 2 or 3 a week. But if you look at people that have done that many facelifts, you will usually see a significant level of expertise, that they have darn good results, and there's some common denominators, okay? They're pretty passionate about what they do, they love what they do, and they're continually trying to perfect their procedures, making them safer with the most predictable outcomes, okay? So certainly there are many surgeons out there that do great facelifts, and I think that our practice has grown to be one of the larger facelift practices on the East Coast. I'm proud of that, and I have a great staff, and again, that's our commitment. When I go to bed at night, I think about facelift surgery. When I get up in the morning, I think about facelift surgery. So back to the question. Is there anything really special about a deep plane facelift? Well, a deep plane facelift just means that you're going under the SMAS, okay? And the SMAS is the layer that's the muscular layer, or the deep layer under the skin. So I think, and I know really, I don't want to say I think, that a well-done facelift, in my opinion, should include a platysmoplasty, where you're making an incision here and doing something with the platysma. Obviously, incisions in front of, behind the ear, and you have to do something with the SMAS, okay? Now, some people do a SMAS plication where they just pull it back. I like to do a SMASectomy, and I do what I call a C-SMASectomy, which is I'm approaching the SMAS in numerous segments, so I control the mid-face, the area around the cheeks and jowls, the area under the jawline and the neck, and that's my specific way of doing it. So you can do, again, plication, you can do SMASectomy, you can do deep plane lift, there are high SMAS lifts. There's a lot of ways to manage this SMAS layer. But what's most important really is not which lift you do, it's how good you are at managing it, all right? Now, I have friends all over the world that do facelifts, and some of them do it the same way I do, and some of them do it different. Some people use different techniques. But you know what? The people that do a lot of this, they're really good at it because over decades, they've developed whatever technique that they do, whether it's SMAS plication, SMASectomy, deep plane facelift. They have modified this and developed it to work well in their hands. And you can't say that just any, like, oh yeah, deep plane facelift's the best lift there is. Well, what if the person doing it doesn't have a lot of experience, okay? There are pluses and minuses about any technique, but in all honesty, it's the final product. If you have a happy patient with a natural result and they had a safe experience, then the procedure you're doing is the best procedure. And like sports or like cooking or like music, there are people that do things different ways, but they do it really well, okay? So one of the things that we all have to be careful about is hyped marketing, and you see so much of that on social media and even on YouTube where people inventing facelifts, and they have magic facelifts, and they have facelifts with all these exotic names, or they have a facelift named after themselves. It'd be like me having the Niamtu lift or something. And you know, it's a generic procedure. There are different ways to do it. And there are many, many different ways to do it. And then you have filler facelifts and vampire lifts and all these lifts that aren't really facelifts. But when it comes down to a facelift, you have 5, 6, 7 accepted techniques to do it the right way. And as long as you're having someone that has a lot of experience, it doesn't matter if it's deep plane or smastectomy. So don't go into this thinking that you have to have this specific type of lift, or you're not going to get the correct result. It's more about who you go to, their experience, their safety record, and their outcomes. So I hope that makes sense. And again, I love doing this. I'm happy to answer any questions on YouTube. I know I rambled on a little bit, but I think it's important things to consider, and I appreciate you bearing with me. I'm going to show you some before and after pictures of my own facelift cases and maybe talk a little bit about what the different SMAS techniques are, so please stay tuned. I'm Dr. Joe Niamtu, lovethatface.com. Okay, thanks so much. Now the fun part. We're going to look at some facelift cases. I'm going to show you about 20 cases before and after, and you don't have to watch them all. But if you're thinking about having a facelift, it certainly is a good investment to spend about 25 minutes to really research and understand what a facelift does and doesn't do. So we'll show you some big lifts, some small lifts, some females, some males, some light-skinned patients, some dark-skinned patients, and let's proceed. Again, I have told you numerous times throughout this video that I feel that I'm just the luckiest guy in the world, that I get to go to work and do this kind of stuff every day. I love making people look younger and doing safe and effective facelift surgery with natural outcomes. Okay, the first case is going to be a face and neck lift, upper and lower blepharoplasty, a chin implant, and a full face laser skin resurfacing. So if we look at the before picture, we can see that the aging face is square. You see how that is square on the bottom because of the jowls and the fat and the extra neck skin. And after we do the facelift, we make this into a tapered face. And a tapered face is youthful. And that's a common theme throughout this that I want you to pay attention to. So again, you have this patient with jowls, fat under the chin and extra neck skin, and that's before, and the right picture is after. Same thing. We also did a chin implant on this patient. I'm sorry, I'm not sure if I mentioned that. So we've taken this recessive chin, this fat, this jowling, extra neck skin, and made this nice youthful angle. This patient probably hadn't had a neck like this since she was in high school. Same thing. Everything is just excessive here, except her chin, which is recessive. And people with recessive chins and facial aging, the fat and the skin, it just all stacks up on their neck. By doing a face and neck lift and refining the jawline and tightening everything and doing a chin implant, it makes an entirely different patient. And this patient is so happy, okay, not because how she looks, but because how she feels. When she looks in the mirror, she feels like a different person. And so much of cosmetic surgery is not just how you look, it's how that look makes you feel. Very important. Another picture from the side. So that was a very happy patient. Now this is a small lift. Again, some lifts are very big. Previous lift was kind of a medium lift. Here's a smaller lift because the patient has smaller aging. So here's a patient in her mid-50s who has pretty good genetics. Her aging is not severe, and she required a smaller lift. And so this is it's kind of a small version of the comprehensive facelift, and you can see the improvement of her neck and her jowls. Here is the three-quarter view of the same patient, and again, you can see the improvement of her neck and her jowls. Here's another patient that did not have a gross amount of neck skin, but had a very deficient chin and pretty significant jowling. So we did a comprehensive facelift with a chin implant, and that chin implant made all the difference in the world. This is a very happy patient and a very happy doctor. This is the side view of the same patient. So you can see that the patient has some wrinkles and some skin excess and some jowling here and a little bit of fat and crinkly neck skin. That's before and that's after. This is not a patient that had tons of excess skin. We took very little skin off this patient, but certainly enough to go from here to here. Same thing. We have this aging, crinkly skin. We have fat here. We have jowling. We've lost the mandibular shape, and we have all this extra skin. Now this patient has a much more youthful profile. And again, many times these patients tell me that their neck hasn't been this tight since they were in high school. Same patient before and after. Same patient before and after. Okay, so when I say comprehensive facelift, basically that is my go-to facelift, and that is a typical facelift. Incisions in front of the ear, behind the ear, an incision under the chin. We do a platysmoplasty to tighten the neck muscles, and we do a smastectomy to tighten the deep structures within the face. So when I say comprehensive facelift, that's my regular adult facelift. And this is a patient in her 60s. She had jowling and some really thick banding and extra skin here. And if you look, we have given her jawline back and given her neck back. Now, this is a big lift because there's a lot of skin, and that's just heredity. This patient has no fat, no body fat. So we had this jowling, and we had this excessive neck skin, and we had this droopy chin. So afterwards, we have a nice tight neck and a better chin profile and a better jawline. This is a very happy patient to go from here to here. And that's a comprehensive facelift. Takes about 2.5 hours to do, has about a 2-week recovery. This is the patient's before and after incisions. So this is before her facelift. And if you follow my work, you know that I do this triarcuate incision in front of the ear. And you can see that you can barely see where her facelift incision was. This is the before on the other side. This is the after. I take great care. In over 3 decades of doing surgery, I think I've developed pretty good skills in scar management. And I am very pleased with the scars that I get from facelift surgery. I can't say that it's impossible that we ever have an ungraceful scar, but it's really rare. And if we do, we will laser that scar or treat it otherwise. I pay a lot of attention to my scars because that is my signature. And I do a lot of work inside there. But you know, the only thing that the patient or the hairdresser or the husband sees is this after scar. Another comprehensive face and neck lift. Again, here is a patient with just a lot of extra neck skin, which is heredity. You know, these patients will tell you their mom had it, their grandma had it. Have this jowling here and loss of the definition. So look at the before and the after. This patient is looking down at the ground, and this is the pose or the view that we hate to see when we're doing FaceTime or any type of thing where we're looking down at a device and we see our profile. It just, you know, a lot of people come in for surgery because they didn't realize they were this bad. This is the before the facelift, after the facelift. Makes a huge difference. And I call that tech neck. So we've improved the jowl, we've improved the neck. And this patient went from a straight line with hanging skin to a better, more of a angled profile. and defined jawline. You can see her scar is still a little bit pink. This is probably about 8 weeks after surgery. Usually by 12 weeks after surgery, the scars are pretty imperceptible. Another comprehensive face and neck lift. Again, this patient is in her 60s. Her chief complaint were these jowls and all this extra neck skin. Before, after. The patient from the right three-quarter view, you see the extra skin, you see the jowl. Before, after. Here we have a tight neck and a nice smooth jawline. Also, you notice that her marionette lines improved here. From the side, you can certainly see the improvement that this patient had. And as females age, sometimes they get this ptotic chin. Sometimes it's referred to as a witch's chin where it droops. And we're usually able to tighten that up a bit when we do this procedure. Here's the patient's before facelift. Here's after her facelift. The scar is really imperceptible. Here's the other side before, the other side after. If you really sneak up and look, you can see a little bit of a scar, but it's a great trade-off for the rejuvenation. Another comprehensive face and neck lift. This is a patient that was just really an amazing case. Really nice patient, and she was really bothered by this hereditary skin excess, this turkey gobbler. And this patient wasn't that old. I believe she was in her late 40s or early 50s. And we just changed her life by restoring her profile. And if you look at the incisions, they look great. If you look at her earlobes, they look the same after surgery. These are all little important nuances of facelift surgery. And where she just had this really full neck that would hang over a turtleneck or a collar and no visible jawline. After I did her facelift, she has a nice visible jawline, a nice tight neck. I can't tell you how happy that patient is. And here is her before, where her incision will be. Here's her incision after the facelift, before, after. Another case, a face and neck lift only. This is an African American patient, a lot of neck skin and jowling, and you can see that neck skin is tightened in the after picture. Such a happy patient to get rid of this stuff and get rid of all these creases and folds and extra skin, as well as to now have a jawline where she did not have that before. You can see the obvious improvement. And it makes me feel so good when I see these patients to remember each case and remember how frustrated the patients were with their aging and how happy they were after their surgery, how it changed their lives. And that's what makes me feel so happy to have this skill set to be able to change people's lives. I take that very seriously, and it's truly a passion. And this patient basically had no profile, and now we have given her a profile. Here's another patient, Latino patient. And again, we operate on all skin types. And this patient, was in her early 50s, and she had some jowling and some neck skin. And you can see the difference that we made. Very happy patient. And look at her incisions afterwards, and if you notice, her earlobes look exactly the same. You see a lot of people after facelift surgery that have very deformed earlobes. This is an Asian patient, so just showing you different skin types. And we did a facelift and a small chin implant. And this patient was in her 40s. She was young, but she was bothered by her heredity and knew where this was going to go in the future. This case is a comprehensive face and neck lift, along with simultaneous cheek implants and laser skin resurfacing. And this is a case that is really one of my favorite cases because it's a patient that just looked old and tired. When she came in, she says, "Doc, I look old and tired." And so the cheek implants filled out her cheeks. The facelift made just a world of difference in her marionette lines, in her neck skin, and in her jowls. She didn't have a jawline. Now she has a jaw. And again, look at the patient on the left. Looks like an aged, tired patient. Look at the patient on the right. She looks smooth. She looks more volumized. Having these cheek implants makes a huge difference because when you have all this drawn looking region here that's hypovolumized, just by replacing that volume, and I like to use cheek implants. I have them in my own face. And she had this typical elderly jawline with the multiple contours and the jowl sticking out. Now she has a youthful jawline. This is exactly what a facelift does. The next case is comprehensive facelift, cheek implants, and a chin implant. Again, this is a small procedure. I think this case took 2 hours, and this patient was flat here. So we put cheek implants in, and now she has nice youthful roundness. She had this hereditary neck skin. She told me, she said, "Doc, I know where I'm going to be by the time I'm 55. You got to do something." So did a facelift, and just a fabulous case on a fabulous patient. This is a facelift and upper eyelids. And you can't see the upper eyelids, obviously, but same thing. We have extra neck skin. We have these bands and these ringlets. We have this jowling. And now we have a tight neck and a tight jawline. We've gotten rid of this jowl and have a nice youthful jawline. Improved this neck skin. And this patient actually had a little bit of wrinkling here. And we went back and lasered that. I need to update my picture because just a little bit of laser resurfacing smoothed that out. It's interesting. You can see where her mole was before surgery and where it is after surgery. So you can see how we've tightened this. Again, I think if you want to judge a surgeon and their expertise, you can look at their earlobe positions before and after. You can look at their scars before and after, and look at their hairlines before and after. And that's how you can tell somebody that knows what they're doing. Before, after. Before, after. She went from having no jawline to having almost a 90-degree jawline, like she did when she was youthful. Here's the patient looking down. When she was doing FaceTime or something, this is what she sees, and now it's much improved. Here's her before incision, after incision. Before incision and after incision. And I really think that I have figured out over thousands of facelifts and decades of working on this, and I do this incision that I call a tri-arcuate incision, and I do it in front of the ear so you never see my tragus. This is called the tragus, this little hump here. And you'll notice that a lot of people after facelift surgery, you don't see their tragus anymore. You can look right in their ear. So I make my incisions out here in front so it always preserves that tragus. And I'm not saying by any means that I hold the keys to the universe for facelift incisions, because different doctors have better success with different incisions. But I can tell you this, I have figured out what works best in my hands and is really aesthetic on my patients. I get a lot of referrals from hairdressers. And when that starts happening, you know you're getting somewhere because they see the good, the bad, and the ugly scars. Next patient, face and neck lift, upper and lower eyelid surgery and chin implant. And this patient just had thick nasolabial folds, thick marionette lines, thick neck, and we've improved that. Now, the facelift is never going to make all of this stuff in the center improved. The facelift does very little for the central part of the face. It's really from the nose down to the collarbone where you get most of your effect. And if you look at these two patients, this looks like this patient's mother, or at least her older sister. It's such a great feeling to take somebody that looks like this, do a facelift and a chin implant, and make them look like this. This is why I love what I do. Here's face and neck lift. This is a smaller lift, okay? This patient has no body fat, really. A little bit of jowl, a little bit of neck skin. And truly, I don't think this patient could have had a better looking neck when she was in high school. Same patient, same patient. Here's when she looks down before surgery, after surgery. Another face and neck lift. This patient's in her 60s, very thin lady, so we did not do any or very little fat recontouring or removal. A lot of jowls, a lot of neck skin. She has these neck bands before, after, before, after, before, after. Here's again, some patients have a facelift by itself, but most patients are doing at least their eyelids when they do a facelift. So here's facelift, upper and lower eyelids, and laser around the eyes. This patient's in her 70s. She looked very tired and just, you know, complained about this aging look in this area. And we have definitely made her look more awake, more alert, brighter, younger. And our goal is not to make these people look different. We want to make them look as good as they can for their age. It would be inappropriate for me to try and make this patient look like she was 40 or even 50 because she's in her seventh decade. We want to make her look like a really great 70-year-old. Here's her eyelids that just happen to be in the same group of pictures. So you can see the before and after pictures of her eyelids. This is face and neck lift and cheek implants. And when I say face and neck lift, a facelift includes the neck. All right, people are confused about that. And so a facelift is really a face and neck lift because it really addresses below the nose to the collarbone, lower face, and the neck. Here's a great example of the square aging face. It literally is like a square block. And after we rejuvenate it, it is oval again. It's a youthful, heart-shaped face. And a lot of people don't realize, when we look at somebody, why do we know they're old? Well, one of the reasons is, they don't have any volume here. All that volume is falling down here. They're square. They have extra skin. So these are some of the reasons. And you talk about a happy patient. I can't tell you how many other friends this patient has sent me to do facelifts. To go from basically her extra neck skin started at her chin and went to her chest. Just a great feeling. Now, here are some cases that you may have seen on my webpage. These are older. Some of these I probably did almost 20 years ago. But they're still oldies but goodies, and they're in my Hall of Fame. And here's a patient just had a high BMI, a lot of body fat. We were able to sculpt that, did her eyelids, did her cheek implants, and her face and neck lift. Huge difference, life-changing. Here's a patient, one of my nicest patients I've ever had. I did a upper lids, lower lids, cheek implants, chin implant, full face laser, and face and neck lift. That's most of the things I do on one single patient. So that probably took about 4 hours, but truly transformed this patient. This is one of the patients with the largest amount of skin that I've done, and obviously so happy. And if you look at her incision before and after, I don't think anybody's going to walk up to her and said, you had a facelift. The only reason they're going to say that is seeing what a difference she has here. It's a patient like this that may get their driver's license picture retaken, that it's such a dramatic change. In terms of males, so this is the frontal view of a very busy professional patient who is in his 60s and has just kind of just felt that he needed some rejuvenation, that he was looking old and tired and very, very busy and stressful job. And this is after a comprehensive face and neck lift and cheek implants. And the patient had a hereditary excess of skin. He had a lot of skin under the neck, and you can see the difference there 3 months later. This is another view of the same patient. And again, we're not trying to make people look like they're 20. We're trying to make them the best version they could be for their actual age. We want this to whisper and not to scream. Here is another view of the patient. Uh, and, these are more challenging lifts when you have this much neck skin, and the patient had jowling. He also had a lot of skin wrinkling, and you can see that some of that is improved significantly just by stretching the skin. Here's the right profile view of the patient. And I tell you, as a surgeon, this really makes me feel good that I was able to change this person's life. He's extremely happy, and I feel very fortunate to possess the skill set to be able to do this. Another view of the same patient, and it really makes me want to have a facelift myself, because these are just life-changing procedures, and this patient was so nice and so grateful for the changes. Males are obviously a smaller part of all cosmetic surgery, but it's a growing portion. And here's a male with heavy jowls, heavy neck skin before and after. Another patient where we got rid of the skin and also did his eyelids. Uh, you can just barely see his scars. If I waited another month to take that picture, you probably wouldn't see him at all. And his earlobes look perfectly natural. And his hairline and his sideburns haven't changed at all. Before, after, before, after. Another male patient, very, very thick, heavy neck, before and after. Another male. Another male with a lot of skin and no jawline. You basically just don't see a jawline here on this patient. And now you see a more youthful jawline. Another male patient, just a big guy. He's about 6'5". And if you notice here, he really had a recessive chin, and he had this advanced aging. So we did a chin implant and a facelift and pretty much changed his profile, and I think changed his life. Another view of the same patient. So basically, give me 2 more minutes here. I am very, very involved in what I do for a living. For a lot of people, it's a job. For me, it's a passion. I still have a lot of outside interests. I have a lot of hobbies. I have a family, and I have 2 special needs children that demand a lot of time. But my outlet and my passion is my job. I do a lot of teaching. I have a cosmetic surgery workshop. I've done this. I used to do it several times a year. This year was our 41st workshop, and we have doctors, surgeons of every specialty come from all around the world. I have an online video series for students, residents, doctors to learn or to brush up on their cosmetic surgery. This is available to download. And I'm a prolific writer. I've written hundreds of articles on cosmetic facial surgery. I've written about 30 chapters in other people's textbooks, and I've written 7 of my own textbooks. My latest textbook is The Art and Science of Facelift Surgery, and my flagship book is Cosmetic Facial Surgery. You're looking at the 2nd edition. I'm currently writing the 3rd edition, and this is published by Elsevier, the largest medical publisher in the world. And I'm happy to say that these books are in the top medical sales on Amazon. It really makes me proud because I poured my life's work into these books. I am very involved with teaching. As I said, we have our courses every year. It is not uncommon to have residents to occasionally come and observe surgery, but when I do my course, we have a full house. Never, ever does anybody ever touch a scalpel except me. I'm the only surgeon, but when we have these courses, they're very popular, and patients actually kind of line up to be part of this course because it's a great learning and teaching experience. So basically, my name is Dr. Joe Niamtu. I practice cosmetic facial surgery in Richmond, Virginia. Face lift surgery, face and neck lift surgery is my passion, and I think I have one of the largest practices on the East Coast. We see patients from all over the country and all over the world. I do a lot of online consultation. I'm happy to look at pictures and talk to patients about their surgery, and it's just something that I love doing. My website is lovethatface.com, and my website is full of more videos and cases. I have 9,000 before and after pictures. And our phone number is 804-934-FACE, which is actually 804-934-3223. I want to thank you for giving me the greatest gift of all, which is your time. And anytime you can sit down and talk to a world audience about your favorite thing in the world, life is great. And thank you again. I'm Dr. Joe Niamtu. Stay safe.